Hi, my name is Elizabeth Maddie, and I'm going to be doing a cardiovascular assessment on an adolescent patient. So I've washed my hands, came in the room, introduced myself, explained the procedure to my patient, and now we're going to get started with a little history. So hi, Sammy, have you ever had anyone listen to you before with a stethoscope?
Bunch of times.
Okay, so that's what I'm going to be doing today, and just checking you out to make sure that everything's normal, okay?
Okay.
Okay. So I'm going to ask you some questions. Have you ever had any health problems before?
Not really.
No? Never been in the hospital? Nothing like that?
Mm-mm.
Do you take any medications every day?
Not every day.
Okay. How about like when you do a lot of like physical activity? Do you ever get tired easily?
Yeah, but not really.
Not really? Okay, so like you get tired if you run a lot?
Yeah.
Yeah? Okay. But not if you're just playing with your friends, you don't get tired?
Yeah.
Okay. Have you ever had any pain in your chest, like up here?
No.
No? Okay. All right, perfect. Those are all the answers I'm looking for. Okay, so she's in a hospital gown or a doctor's gown, and I'm just gonna inspect her chest just to make sure there are no abnormalities, no pulsations that I can see right off, and her breathing looks normal, no distress or anything like that. So I'm gonna start off just by listening to the carotid arteries. Okay, listen up here. And I'm just listening for any bruit. Okay, I'm going to listen to your heart now. And I'll listen for a full minute at the apex of the heart, just checking the apical pulse. Okay, now I'm going to compare her heart rate with her radial pulses. And they sound equal. And I will go back and listen again with the bell of the stethoscope. Okay, that sounds good. And I'm going to have you lay back for me and have you turn slightly to the left, and I'm going to listen to you again, okay? Just turn onto your left side. Onto your left side. Turn this way. Lay on your left side. On your side, Sam. Okay, now I'm going to be listening in the same 5 points. Noting any differences I may hear. Okay, sounds the same. So I hear S1 and S2 in every location with no abnormal heart sounds noted. You can come back and sit. And I'm going to have you lay back that way. So I'm going to palpate the femoral pulses. So they palpate fine. I will palpate the posterior tibial on both sides. And do the pedal pulses last. And while I'm doing this, I'm also feeling to see if there's any edema in any part of her legs. Do you ever have any swelling in your legs?
Never.
No, and she has no edema. Okay, go ahead and sit up for me. All right, and that that is the cardiovascular assessment.